things are so obvious that indeed, I just wonder why my poor colleague, and I like him very much. I mean, we have been traveling through the world together, and indeed, we meet several times at conferences, and hopefully it's not always a neuro-congress. I mean, so it's indeed the discussion will be why NeuroICU, and indeed it's a very, very important question. And so first, I would like to refocus a little bit, and just to ensure that we are really talking on the same issue. Indeed, we are talking a NeuroICU and not a stroke unit. So we are not talking on specific care of a patient with a cerebrovascular accident that indeed will go totally outside an ICU and just with specific care there. I mean, because indeed, we're also talking a cardiac ICU, which is not the same as the coronary care ICU, when the patient are taking their coffee and chatting with families and so on. And we're also not a surgical ICU and post-operative care unit when people are indeed because of the appendicitis and other things like this. So we are really talking on critically patients with neurological problems. And so indeed, what is exactly an ICU? Because the ICU is there. So it is a specialized section of the hospital. This is very important, of course, that provides comprehensive care and continuous care, also very important, for persons who are critically ill and who benefit from treatment. So it's a very general term. Indeed, it can apply to all kinds of patients we have, including, of course, neurological patients. And so, what are exactly, if you look at literature, the specialized ICU we may find? So we have, of course, the neonatal ICU, and I don't think that we should mix the neonatal with the other one. We are really too specific. We have also some others, and we have indeed a long list, and you can find here the neurointensive critical care unit. But also you have the geriatric intensive care unit, and the trauma neuro. So what do you do when you have a geriatric patient with a neuro issue, and indeed also a bad heart? You put the, you split the patient. So indeed, what do? I mean, we have the multidisciplinary ICU, which is indeed where we'll take care of patients with problems with their lungs, and also patients with problems with their heart, and we'll even understand what is heart-lung interaction. This is great. We understand this. We also have patients with coma, and we also understand the interaction between the lungs, the ventilation, and the brain, and the heart and the brain. We understand all these factors in a multidisciplinary ICU. And also the consequences on other organs like the liver, also the kidney, acute kidney injury, and other factors that are very important. Well, for the separated ICU, we have indeed the NeuroICU. We have the respiratory ICU. These are very specialized people that really take care of difficult patients to ventilate, including winning patients of COPD. And we have, of course, the cardiac ICU. These cardiologists know especially well that better than we are to treat patients with myocardial infarction. And of course, we have the liver ICU for all these patients with acute intoxication that cannot be taken care of in the normal ICU. And the nephrologic ICU. My gosh, we forgot about these people. And then indeed, we have all these kind of small part ICU, and we can indeed separate each of them and have indeed a kind of piece of ICU, and each one has a very bright specialist that know exactly what they do in their specific organs. Okay, they forget a little bit about the other organs, and so we can indeed have in the hospital a general ICU, a surgical ICU, which is, by the way, the medical ICU with a few scars, and then you have the neuro ICU, or especially with the brain, and the other. Oh, please, give me a break. I don't like this puzzle ICU. I really prefer this multidisciplinary ICU. I mean, we really have to have this interdependence of all the organs. And why is it very important to have this integrative model? Because indeed, just figure out, you have this kind of patient, a very classical one. I mean, you have the patient coming in the helicopter in Leuven a few minutes ago, traumatic brain injury, liver trauma, and some aortic trauma. Well, where do you put the patient? Well, of course, in the neurostocated unit. I mean, the NeuroICU. If the brain is not working, who cares? Okay. But he has also a little bit of liver trauma, and so maybe we should put him on trauma unit. No, he was operated. No, operated so in surgical ICU, for sure. They know everything. These are the boss. The surgeons are the boss here. not the ridiculous NeuroICU doctor. And so indeed, we have then some people say, the heart is the most important aspect. If the patient dies from his aortic laceration, who cares about the brain? Well, that's not false. I mean, so indeed, how do you deal with this? Well, the only solution, I totally agree, is the multidisciplinary ICU. At least there, all the people that will take care of the patient will take care of the patient, and not only of a single organ. Okay. And so indeed, what are the issues of the over-selective, over-specialized, compartmentalized ICUs? Well, the first aspect is, what do you do when there is no room available in NeuroICU? Professor Nino Scottonetti is very known, so everybody in Italy wants to be in his unit. Okay, but then at some point, unfortunately, you have too many traumas. And so what do you do at that time? Well, no, I'm afraid you have to call the ridiculous guys here, Daniel DeBacker, and go into this ridiculous ICU. They don't know how to treat these patients, that's true. These nurses, they never see a trauma patient. What is an ICP? How do you take it? Oh, yeah, I measure it like this. Yeah, okay. The monitoring. Do you know where we find the monitoring to measure the ICP? Do we have the PU2 measurement of the brain? No. A Doppler? What do you take it for? Okay. Do you call Nino Scottonetti to come from Milan? No, it will be difficult. And of course, the environment will be totally unknown for the surgeons who will say, oh, where is the door? Okay. Where is the light? Can you show the door? Okay. Everything there is, of course, quite difficult for these conditions. The other aspect is what you do in the specialized ICU, NeuroICU, when the patient develops a complication. Okay, it will not develop the complication because it's taken in the best hand of the best doctors of the NeuroICU. Yes, still, sometimes there is some pneumonia, sometimes there are some other complications. Indeed, what do? You transfer to the other ICU, or they will not take care of the brain of this ridiculous ICU. So you leave the patients in the NeuroICU, but yeah, okay, we know to do what the ICP, but how do we measure the cardiac output? Not difficult. Non-adapted monitoring once again, and so very difficult. So okay, I'm making the case is you exaggerate. No, maybe I exaggerate, but you know these kind of things. You all know that some of these patients have what we call this takotsubo. And indeed, a neuro patient never develops these kind of things. Oh no, never develops this. He will never be in cardiac shock. He will never be dying from his heart having been injured by his brain. No. Oh yeah, it occurs. It just depends on the age of the world. Oh yeah, sometimes it occurs. So what do? You put the ECMO, you leave the ECMO in the NeuroICU. Okay. So no, at the end, I think that the only way is indeed to have what we call the NeuroICU. We call systematic ICU, multidisciplinary. And if you push, by the way, the extreme of this reasoning is that everybody is better in a single location. You may say it's the same for all the other aspects. And then you end up with this. And I'm sure that so Odomoro will remember this. We were in a video together in that hospital, a neuro hospital. Everything else that the brain doesn't come to. They are just treating the brain. Good pictures, 7th floor of a very modern ICU. Everything, ICU, every place there is just devoted for the brain. So no, I think at some time we have to stop. And we have to stop, and we have indeed to go for a more multimodal modality, which is indeed the multidisciplinary ICU. And then indeed, it is a sole model, really the sole model, that allows really an integrated care with complex critical indications. I don't say that for a patient who is quite simple, cannot go for a specific place, but it's more perhaps again a stroke unit. And then indeed, it includes patients with neurologic problems. Some will of course say, it's difficult, it's closed ICU. No, it's no more closed ICU. We have to open our doors. Indeed, we have to be open 24/7 to everybody, not only the families, but also indeed the different people working together with a neurologic consultant, with a neurosurgeon, and we have indeed to have a huge collaboration to treat as best as we can these very complex patients. We have just nothing else than a brain, but also have a body beyond the brain. With this, thank you very much.